I'm Dr. John Stenberg at Zenith Chiropractic in Colorado Springs, and I've been dealing with a number of patients lately who have a diagnosis of fibromyalgia. Now, fibromyalgia is not widely understood in terms of its cause, and as such, conservative and effective treatments are really hard to come by for individuals. Now, we don't always know exactly what causes fibromyalgia, but there is a common consensus about what's happening in the body with a patient that's experiencing fibromyalgia. And essentially, it's a hypersensitivity to pain. It's a distortion in the communication between the brain and the body that is producing abnormal sensations to otherwise normal experiences. So the result of that over time is that folks will develop chronic widespread pain throughout their body, which is clinically diagnosed as pain that's lasted for more than 3 months in 11 out of 18 different areas of the body that is no other reason to be attributed to. So if you meet these criteria and all other testing is quote-unquote normal, then usually you'll arrive at the diagnosis of fibromyalgia. Conventional fibromyalgia treatments are going to be geared towards blocking pain signals or dulling pain signals coming to from the brain, or treating the painful tissues throughout the body. Now, if we take it a step back and understand the big picture and that piece about the distortion of communication between the brain and the body, that's where we have an often overlooked area of improvement for a lot of patients with fibromyalgia. So that communication between the brain and the body has a few really important structures to consider. Number one is the brain itself. If everything has been cleared and the brain itself is healthy and functional, then the next step down will be the brainstem. The brainstem is the lower part of the brain, involves the pons, the medulla oblongata, a variety of other structures, and extends its fibers down into the upper part of the neck. Now, this is like the thermostat or the switchboard of the nervous system, in that all that information coming through the body has to be relayed through the brainstem to different portions of the brain. When you're having normal signals that are coming to the brain and they're being interpreted in an inappropriate way, it's important to consider that there might be an issue in the relaying or the switchboard area of the nervous system. So from a chiropractic perspective and a structural perspective, there are a few important considerations with the brainstem region that we need to evaluate for patients that are suffering with fibromyalgia. The upper cervical spine, also known as the craniocervical junction, is the most movable part of the spine and as such susceptible to injury. The atlas, which is the top bone of the neck, is a tiny bone. It weighs only a few ounces and supports the weight of your head, which is about as much as a bowling ball. Now, for most folks that have deconditioned cervical spine musculature or weak muscles around the head and the neck, when they have a slip and they fall and they hit their head, they have a sports injury or involved in a motor vehicle accident or whiplash type injury, their musculature is not strong enough to support the weight of the head moving around on the upper neck with those forces added. So what can happen is a displacement of the joints between the head and the neck, which will then heal in an abnormal position and retain abnormal mechanics. If you have abnormal mechanics, over time there's going to be wear and tear associated with the joints moving improperly. That mechanical irritation happens at the surface level of the joints, but it also extends out to the tissues around that area of the spine. So of importance with patients in fibromyalgia is the close association between the fibers of the brainstem and the upper portion of the neck, the upper cervical spine, again that atlas and axis vertebrae, this first and second cervical vertebrae. So what I found in dealing with patients that have fibromyalgia is two things are missing in an overall comprehensive understanding of their condition. Number one is the history of structural trauma. So what are those different injuries that they've sustained over the years, and how could that be impacting the form and function of the spine and subsequently the nerve system? And number two is, how do we conservatively look at improving the function of the nerve system, relieving irritation associated with abnormal mechanics, and getting the body into a state of balance so that that hypersensitivity can start to relax on its own. More often than not, when we evaluate these patients, we do find that there's a hypersensitivity of the nerve system or an imbalance between the sympathetic and parasympathetic branches of the nerve system, and we do find that there's abnormal alignment and mechanics in the upper cervical spine. So with that information, we develop a plan to then stabilize and correct that area so that the healing process can take place, and over time, some, if not all, of those symptoms can subside on their own. And if they don't, then we have an understanding of where additional therapies and treatments and modalities need to come into the picture to round out the care in a more comprehensive way. So if you're in the Colorado Springs region and you're experiencing chronic pain syndrome such as fibromyalgia, or you've received a diagnosis of fibromyalgia, you deserve to know if the structural stability of the spine is impacting your condition. So I welcome you into the office for a complimentary consultation, which is an opportunity to share your story with me, to learn more about how we evaluate and manage patients with fibromyalgia, and to determine if neurostructural chiropractic targeted to the upper cervical spine is a potential solution to get you back on a path of full function, good feeling, and living a quality life.